I'm now going to turn it over to the next panel discussion, which is Understand Together, Co-Creation and Implementation of a National Dementia Inclusive Community Symbol as a Sign of Solidarity and Support. And I'm going to turn over to Fiona Foley, who will introduce the panelists. Thanks, Fiona.
Thanks very much, Kim. We're delighted to be joining the conference today, and hello to everybody out there watching. My name is Fiona Foley. I'm the National Coordinator of the Dementia Understand Together campaign, and I'm a Senior Project Manager with the National Dementia Office here in Ireland. And I'm joined by Kathleen Farrell, who is a member of the Irish Dementia Working Group, but she's also a member of our Campaigns Working Group, and also by Fiona Crotty, who is an Administrative Officer with Tipperary County Council and also the Age Friendly Programme Manager. So what we'll be doing today is we'll talk about the Dementia Understand Together campaign and a new symbol that we have launched to show that everybody in our community is showing their solidarity with people with dementia. So I'll be presenting for about 15 minutes on that, and then we'll have a Q&A with Kathleen and with Fiona Crotty after that. So I'll share my screen with you here now. So I hope everybody can see that okay. So the Dementia Understand Together campaign, what is it? It's actually a campaign that's a real collaboration. While it is led by the HSE, we work really closely with the Alzheimer's Society of Ireland, with Age Friendly Ireland, Dementia Services Information and Development Centre, Age and Opportunity, and Healthy Ireland. So there are some key stakeholders that work together on this campaign. And why is this campaign so important? It is a dementia awareness and understanding campaign. So what we're really trying to do is get the mission out there that we change our communities, that we make them dementia inclusive. And the reason why we're doing that is in Ireland, we have 64,000 people living with dementia. And this number is set to increase within the next, by 2045, it'll double. And so it really affects a vast amount of people here in Ireland and their families and their supporters. So what is our vision? We really want to create an Ireland that embraces and includes people living with dementia. While this campaign is a collaboration with a lot of different stakeholders, it is also supported by over 40 national partner organizations and local community champions. And that is the real key about this, because whenever we talk about dementia, it really affects more than the person. It affects the families, it affects communities. So it is really important that we also have an answer and come back and support as a whole community as well. And that's where we're really glad that we're working with so many different partners. They're ranging from retail, from transport, from banking, health, and voluntary and community sectors. And then we have our fantastic local champions who are also rallying the troops locally. So when we went out and we talked to people with dementia, we asked them, what is it actually that matters most to them in their communities? And when you look at these four bullet points here, you can really see that it's no different for a person with dementia than it is for ourselves as well. And why should it be? So that people want to be understood and respected and valued. They want to stay socially connected and actively engaged. They want to make sure that they can access their local businesses and amenities, and that they are also responsive to their needs, and that they can access the built environment as well, so that they can go out into their parks, go out into the community. So those are the four pillars that we're always looking at and that we're working at together. So when I mentioned the national partners, I just want to give you a little bit of an idea of what does partner engagement actually look like and what does it mean out there. So these are just some of our partners here, but I tried to get a representation of the different sectors. So you can see, for example, Irish Rail there. So we work with all of the transport organizations, and we have a dementia awareness training for transport staff members, which is called the Elevator Training. It was provided together with DCU. And so staff members in Irish Rail are trained on dementia. They've participated in that training. They've conducted walkability audits together with people with dementia. They had focus groups and workshops with people with dementia. So they've been really listening to what makes our transport accessible and what can we do to support you to be able to use the transport facilities and to go out into your community. So that's just one example. Boots is another example. So again, they're a retailer that had over 2,000 staff members. And what they have done is that they included dementia training as part of their induction. So whenever a new staff member comes in, they are trained in dementia. And so that a person can be responsive to somebody who comes in and might need a little bit more support. But they've also reviewed their store accessibility together with people with dementia. And they're looking at changing signage and making sure that, you know, everything within the store is accessible for people who need a little bit more support. Again, also the banks are out there. So we've been working with the banks, and they have the vulnerable customer team. So they've been trained to be aware of dementia as well and what a person might need. But they're also linking in with people with dementia and also with their families and carers now, because they want to create a specific website and web page to be able to just give clear information of what could be helpful for people who are affected by dementia. And then we work very closely with Age Friendly, and we'll talk later with Fiona Crotty as well, again, about what she's been doing in Tipperary. And Age Friendly have been a key partner to us as well, in that, you know, they've included dementia in all of the business training that they're providing in communities, but also their Age Friendly housing and public realm coordinators are all trained in dementia. So if they go out to support people in their own homes, they also know how they can support a person with dementia. And again, when we look at community links are so important. Men's Sheds organization is a big part of that. So they have included dementia as part of their Sheds for Life program, and they also have created a manual for all of their shedders as well on dementia. So again, these are just some examples, and they can all be replicated across all the different partners out there. So when we talk about community champions, what does champion engagement really look like? So again, we have more than 400 people who've just signed up to the campaign and said, we want to get involved. We want to do something in our community. And we looked at 7 counties specifically just to get an idea of how do these counties go about? What are those champions doing? What are some of the key actions? And what we've noticed now, specifically over the last year and a half, I would say, is that they are forming dementia alliances, so that people aren't out there alone, you know, drumming the drum, trying to make a difference, but that they really see that there's a wealth of knowledge out there, and that it's really important to link in with different people and different local stakeholders, so that you can actually have a real impact in community. And be it that they're reaching out to the Alzheimer's Society, to the Dementia Advisors, to Healthy Ireland, to the local councils, to Age Friendly Ireland, and they all form alliances and come together for dementia. And one key aspect that all of the communities are doing is that they start with dementia awareness sessions. So they invite the community in, they talk about dementia, and then they look at training for specific stakeholder groups such as the libraries or the businesses. So they've been really, really active out there, but also creating dementia cafes or creating specific resources for local communities. And I always like showing this picture because sometimes we think we're out there and we're trying to change something for dementia in our communities, and we might not know where to start, or we might think that we don't have a big impact. But all of us have a really big impact through the behaviors that we are showing. So if we are showing a positive behavior towards a person with dementia, towards somebody in our community, we're showing an action that we are taking to make our community more inclusive. Other people will see that, and people who trust us will follow our lead as well. So they will follow the behaviors. So it's really important that we make these behaviors visible, that we show our actions, that we share our actions, and that way it can spread. It can spread within our communities, it can spread across the country and wider as well by sharing things during conferences like today. So it's really important that we think of ourselves as one of these little dots within a very big picture, and we really do have an influence. We also conducted a national omnibus survey in 2021 just to measure that influence, and we can see that attitudes towards people with dementia are changing, and that is a massive change, that the people are much more empathetic towards a person with dementia, that people would treat a person with dementia just as they would treat anyone else, and that they would accept somebody with dementia as a close friend. So there's a real shift there, and positive shift in that. And I think one big aspect for me always is that people felt that 92% of people who participated in this study felt that people with dementia have the right to be active citizens. And that is really fundamental to everything that we do, that we all can be active citizens in our communities. We also asked our partners and champions, because again, it's a massive network out there, and we want to make sure that they also see that there is a shift based on the actions that they are doing. And you can see here that 80% of the national partners and 92% of community champions feel that there's a real difference of how people with dementia are included and supported in their communities. Another big figure here, which I think is really important, is that there's a real change in people with dementia being involved in activities and as well, and deciding which actions to take. So that's a really positive thing, that we see more and more people with dementia joining the alliances, joining focus groups, and so on. So coming to our symbol now, and why did we develop the symbol? We felt it is really a good time to actually now make it very visible that we have all of these different activities out in our communities. So our ambition with this symbol is that not only will it increase, visibility and awareness of the Dementia Understand Together campaign and encouraging everybody to get involved in this, but it is also a real overarching symbol of solidarity and inclusivity and support for people living with dementia. And it's a sign that communities and businesses and services are working towards being dementia inclusive. And there's just one quote down there that I'd just like to read out. And it's actually also by Kathleen, who will be joining us later. And she said, I think it's going to be a game changer. It's taking things to a whole new level, because suddenly we make it really, really visible out there. So I think that's really important to show. So why does that matter? And I know there's a lot of text on this screen because we'll be sharing the presentations as well. So I just want to highlight 1 or 2 points on this, because we all know that health and well-being is really closely linked to social engagement and the close social engagement we have in our communities. And we know it ourselves from the time of the pandemic, but also through research and through anecdotal stories of people, of what community actually means to them and being socially engaged. We also know that social isolation is very often more likely for a person with dementia, but if they can stay socially active and engaged, it can help in so many ways, because it can slow the progression of dementia, and it can really positively affect mood and the person's overall health and well-being. So it is important that we do everything we can to make sure that people can stay connected in their communities. Also, by raising awareness and showing the symbol now, we really can give people with dementia also the confidence to retain some of their independence and to be out and to ask for help. And it opens up opportunities to participate in activities such as going to the museums. We have fantastic museums here who are hosting dementia inclusive tours, such as the Museum of Modern Art, and that they can get involved in those kind of activities. So again, when we developed the symbol, I think it's really important to say that this was not done in isolation. The first consultations that take place whenever we do anything within the campaign is to talk to people with dementia, to talk to their families, to find out, is this actually meaningful or not? Will it matter or not? And so people with dementia took part in online sessions. We also met with our partners and our champions. We tested the symbol at the National Ploughing Championships. So you have a wide variety of audience at those championships. And we discussed it within our own dementia working group, that also includes carers and people living with dementia. So there was a lot of consultation about the symbol. And this is what the symbol now looks like. And again, the key to it is that, again, from a person with dementia, said, keep it simple. Let it say what it's supposed to say. So this symbol is very simple. It shows solidarity. It says dementia inclusive community. So I guess everybody who would see this will know what it means, that there is that solidarity with people with dementia. So how are we rolling out the symbol? So we did have a launch event and Minister Butler launched the symbol officially. We also had a national media campaign to highlight the symbol and make it visible out in community and what it means to display it. But we also hold a lot of individual briefing sessions because it's important that we have that stakeholder engagement, that we talk to our partners, to our networks, such as Age Friendly Ireland, Healthy Ireland, all the dementia advisors, or the memory technology resource room teams. But again, we also had over 120 engagement sessions with our partners and champions, because we need to make sure that partners can embrace the symbol and really make it visible in the community. So just to give you a little bit of an idea as well of what the poster campaign looked like. And again, these are all people living with dementia. And that was really important to us because this is their symbol. It's really, trying to show that they are embracing the symbol and what the symbol means to them. And these are also their personal quotes. So it is a celebration of them. And that's something that was really important to us. So when we're rolling out the symbol now, there are specific resources as well, because while this is not a certification program or anything like that that is linked to the display of the symbol, we are asking our partners and our communities out there to have a better understanding of dementia and to participate in dementia awareness training before we put out the symbol. But there's also a lot of window stickers, posters, badges. You would see the badge here. You'd see it with Kathleen later as well. And there are, all these items can be ordered free of charge from healthpromotion.ie. And again, when it comes to training and education, we updated the dementia elevator training for retail, financial services and transport. And there's also dementia awareness training online for individuals and for community groups. So there are a lot of resources there to support everybody in the community to display the symbol. And we really want to encourage everyone to get involved. This is our website, understandtogether.ie/get involved. And we really would hope that everybody can sign up as champions as well and be part of this campaign. It's been a fantastic journey. I can just say that. So I'm going to stop sharing now and I'm going to go back to our wonderful community champions, Fiona Crotty and Kathleen Farrell. And I'm going to let Kathleen introduce herself a little bit more herself as well. Hello, Kathleen.
Hello, Fiona, how are you? And thank you for inviting me to speak on what I think is a brilliant opportunity to explain to people what exactly happens when you're diagnosed with dementia. Your first reaction will always be pure fear. I remember when I was 5 months or up to nearly 6 months in hospital, my initial problems were falls, which nobody even, nor I didn't know anything about dementia. And then on the day after about 4 months, they didn't decide on clear on tests that were done. I was told I had Lewy body dementia with Parkinson's. Now, dementia was the only word that I actually got in my head very clear, because it just was something that I least expected. Like my actual falls, my initial thing was truthfully that there was a form of cancer somewhere, because they couldn't seem to have come to a conclusion anywhere. So everybody, that's what I was told, Lewy body dementia with Parkinson's. And then all the nurses and that would come in, and one in particular said to me, don't tell people you have dementia, because they'll change their spin on things. And when she said that to me, in my mind, I got very annoyed and I thought, well, I haven't changed. The dementia is there, but I'm going to live and I'm going to make it my business not to ignore the symptoms and the actual, sorry about that background. I made it very clear that I actually was going to make sure that everybody knew I had dementia, not in a bad way, but when the subject came up. the next thing is that when I was out and about, I actually have a stick for the Parkinson's, and people asked me what was the problem, and you'd say dementia, Lewy body. Now, Lewy body is a different form of it.
Well, we come back to Kathleen, and we'll just introduce Fiona Crotty. Fiona, would you like to introduce yourself a little bit more, give us a little bit of background on yourself?
Thanks very much, Fiona and Kathleen. And I'm Fiona Crotty, and apologies, the two Fionas on the one session. So I work with Tipperary County Council for the last 27 years. And I spent the last 7 years of that in the community economic and rural development section. So within the community sector team, I suppose I work within the quality of life agenda. So that looks and the age-friendly programme manager for Tipperary, but I also support Healthy Ireland and Healthy Communities and the Children and Young People Services Committee. So Tipperary, you might have heard myself and Kevin bantering there before we started, in terms of a very proud county. We have a population of 160,000. We're the 6th largest rural county, but yet we're a very rural county. We have 120 settlements, so it's a really, a small settlements of towns and villages across the county. And diagnosed in the county with dementia, there's 3,500 that are diagnosed. That's the estimate, and we can only assume that that will increase in line with population trends and demographics. And again, people are living within our community. So I suppose our aspiration when we started on the campaign and working with Understand Together, and was ultimately building community awareness, and increasing that awareness of dementia for myself as well as others, in terms of ensuring that, as Kathleen mentioned, about having that that empathy and having that solidarity, and ensuring that was, I suppose, across the county. So if you want to go back to Kathleen again there.
Yeah, thanks very much for that, Fiona. And Kathleen, just coming back to you now, because you've also joined the Irish Dementia Working Group, and you've mentioned how important it is for you also to talk about dementia. Maybe you can tell us a little bit about your work within the Irish Dementia Working Group, but also how you translate that into your own community, because you talk to your hairdresser, you talk to the local shop, you tell people about your diagnosis, and what effect has that had?
A very positive a very positive view was taken. One of the things that comes across from my end of it would have been from the Lewy body, from the Irish Dementia Working Group. I got through to them through the helpline. The helpline really saved me, because one of the days when I was home out of hospital, I felt very down. And it was only when I came home and feeling very not as secure as I felt in the hospital that I realised the situation was more serious than I thought. And I don't even know how it happened, but I decided I would have to ring somebody. And somebody I rang was the helpline, which the number actually is 1-800-341-341. Very easy number to remember. Yeah. I spoke to a girl called Anna, and Anna actually listened for nearly 3/4 of an hour. And then I was feeling guilty then, because I thought, God, I'm after taking all this girl's time up. But she said to me that there was no problem. She could spend any amount of time on the phone. But the more she listened to me, the more what was coming across to her was that I was actually going to be very positive. And then she said to me, look, it's a Friday. I'm going to wait until Monday, which is not because Saoirse Kelly is going to be the girl that will take your mind off everything. And I thought, God, Friday, will I last Saturday and Sunday? But I did. And next of all, it was Saoirse rang me. And from that day, I have just been going from strength to strength. I feel very empowered by the whole thing. It keeps me busy. I'm well able to, of course, I have my off days, and that will happen to anybody. But in general, I have to say, I literally believe that the Irish Dementia Working Group has given me a whole new prospect of life.
I must say, Kathleen, it's really fantastic to hear you say that, because there is so much more to dementia, and to be able to share that with the public, with your friends, with your neighbours, and to be talking about it. And I'll stay with you a little bit, because you also were so actively involved in the campaign now, and in the creation of our symbol. And you're very passionate about that symbol. And I actually really love you saying it's like a badge of honour. So maybe you can tell us a bit about your involvement in creating the symbol and what it means to you.
Well, first of all, I do actually think it's a badge of honour. To me, it's saying to people, look, I have dementia too, but we're all in this together. And one of the amazing things about it was I actually put that symbol on our front door, and right or wrong, my Amazon guy comes on a regular basis, and he asked me, what's the sticker for? So I told him what it was for. Oh, right. And I'd say it must have been about a week and a half, he called again, and he said to me, have you got one of those stickers? And I said, of course I have. He says, my mum has dementia and she isn't that bad. So I told him a bit about what was happening when we were all trying to be together, included in everything. And he took the poster and he said, I really thank you for that, he said, because she's afraid going out. So that was the first one. And then when we were actually doing the making the poster, well, that actually was, I have to say, since I came home from hospital, one of the best days of my life. It was just so inclusive of everybody, the crew that was taking the photographs, my own personal makeup artist, which honestly, I went out the next day and bought concealer for my eyes because I just didn't think that existed. The crew from the IDWG, they were there. I had my own personal minder because unfortunately for me, with my Parkinson's, it does affect my mobility just slightly. And the ways around them were very easy with the stick. And I felt very secure with Niamh from the office. The whole thing was just incredible. We laughed from the time we went in to the time we came home. Taking the picture for me on the actual looking out the window, the poor guy had to literally, he was sitting on his hunkers trying to literally get me to look at him and stop looking out the window because they needed to see the face as well. And I think I actually got a very good photograph of that. That's my self-praise is no praise, but it
absolutely.
It
really, you look fantastic, Kathleen, and
it was brilliant.
Yeah, and I'm so glad to hear that as well. And it is such a different experience again in life, and to be out there, but to be so empowered to suddenly be on the poster across Ireland. And you also, I'll stay with you again a little bit before I go back to Fiona Crotty, because you had a personal experience as well, hadn't you? Since not only the Amazon person is now our advocate out there and widely active for dementia, but you also had a personal experience with somebody calling you on top or after they'd seen the poster.
Yeah, that's right. We're a very close-knit family, and one of the things I was a little bit disappointed in was that some of my cousins just hadn't rang and how are you or whatever, and that did disappoint me. I thought they think I'd changed, that they didn't feel comfortable to ring. And it was only a couple of days after the poster was out there. Actually, the first one that rang said, "Oh, Kathleen, I'm really embarrassed. I thought you were so bad that you'd never get out for a cuppa." and we were going to ask you, and we didn't know what to do. But that was the first one, and I was really, really pleased with that, because we made a positive date to go for that cuppa. And then another cousin literally rang me with the same spiel. Oh, I didn't know you could take, I didn't even think you could talk normally, which I think you can hear. I can talk quite normal. It really, we have gone for that cuppa and we have laughed no end. My niece, actually, I sent me one of these texts with two people sitting on the dart. And I said, why is she sending me that picture for? So I doubted, I texted her, and she came back with the reply, you're not meant to look at the two people. You're meant to look at the poster on the wall, on the thing that says, I'm Kathleen Farrell and I can still go for a cuppa. So in all, there's no doubt in my mind, the symbol is a total success. And all we have to do now is work on it and get people to realise just what it means.
Yeah. And that's fantastic, Kathleen. And thank you so much for sharing that. I think those are just the amazing examples of what this actually can do. And so with that, I'd like to go back to Fiona Crotty, because Fiona is out there active in Tipperary, and she really is mobilizing the troops in Tipperary County to be more dementia inclusive. And Fiona, maybe you can share a bit of your journey and the actions that you've taken so far.
Thanks, Fiona and Kathleen. Yeah, so I suppose our initial journey, timing-wise, was a bit poor in that we were starting with February 2020. We had launched, we were intending to have a geographical training and focus on two geographical areas within County Tipperary, one north and one south. Obviously, then March 2020, the landscape changed. So we didn't want to let. We were on that journey. We were not stopping. So we worked very closely with Understand Together and the Alzheimer's Society in terms of how do we change our delivery methods. So we came up with an online training and supported, I suppose, delivery of online training across the counties. That was that Learn, Listen, Link. And ultimately, again, that was about the promotion and getting that dementia awareness. So we worked, we still tried to do it with 5 municipal districts across the county. So we tried to do that within each municipal district to retain some element of geographical, I suppose, building a community within a radius of each other. So that would have involved staff from our libraries taking part, but also some amazing community champions, Ursula and Thurles, Marguerite Cashel, Anne Ross Gray, Noel and Nina, so all of those champions took part in that Learn, Listen, Link training. And for me, it was about learning what, activities we could do on the ground. We also held training for staff within the local authority. Again, during, I suppose, those 2 years of COVID, we did conduct a walkability audit in Ross Gray and another one in Clonmel. And we're still working through the findings of both of those. We conducted a door-to-door engagement in the towns of Ross Gray, Nina, Cashel and Thurles. And that was to engage all the businesses in those towns to undertake training with Age Friendly Ireland and with the Alzheimer's Society of Ireland to, I suppose, to support people as we positively age in the county. And Ross Gray has been a real success point, and that's, I suppose, down to the local advocate there in terms of and encouraging the business participation. But the other towns we will revisit and we will re-energise and support. So other projects and supports we have done over the last number of years. We've had two fantastic reminiscence projects looking, they've been intergenerational. They've also taken place at our libraries and some of our nursing homes across the county. And we've produced two beautiful publications working with our partners. And for me, it's all about the partnerships in the community. And that's, as the Age Friendly Programme Manager, we have an Age Friendly Alliance and using that partnership to, I suppose, to support the actions. So we, in Nina, they developed a lovely sensory garden and planting guide, again, promoting that reminiscent. And we're hoping then to use that as our template for other community spaces around the county. And we have a very strong tradition of tidy towns in County Tipperary. So it's again something that we can encourage through our tidy town network across the county to plant plans that promote reminiscing across the county. We have a very strong partnership with the library, and they've been fantastic. You mentioned earlier about training as well, and some of the staff have not only done the Learn, Listen, Link, but some in our museum have also done the Azure training. We've with Emma O'Brien, I know she's one of the speakers later on this afternoon. We have a partnership with the Memory Technology Rooms where we purchased and provide the libraries with some Acorn digital devices so that they can be referred from the Memory Technology Room through the library to try out that technology so that the cost is removed for that trial period. We also purchased some magic tables. And again, they're rotated across both the library network and the communities. Again, with the networks across the county, promoting that cafe network. So that was whether that was in terms of promoting of or establishing new cafe in Nina, and that's an online one. We work with Severage and the Sean Donald as the dementia advisor, Noel from Severage, and Afric, a public health our nurse. And so again, we have an online cafe there, and then supporting the cafes in both Thurles and Thurles are in Roscrea. And I know the next presentation after our own is the Dementia Cafe in Tipperary, but so I won't speak on that. But I suppose ultimately across that partnership, trying to resource speakers that are relevant, and we can share that around the county. So if you miss it in one, it's available in another one. So we can kind of try and timetable the supports. But again, it's listening to people living with dementia, so as to what the speakers that they want of relevance as well to them. So we would have also had some branding in terms of, again, it's to try and build that county awareness using. We'll have to update now in terms of the new Understand Together symbol. And
that's really incredible, Fiona, because I mean, you mentioned that you started in 2020, while COVID hit, and just the breadth of different activities that you've been able to do since then, moving online, going back to person engagement, knocking on people's doors, shop front stores, and all the walkability orders. So there's a massive plan in place of all the different elements that will come together to make sure that the community becomes inclusive. And that is really, really powerful. And do you think that the symbol now, because again, sometimes, we're doing all these activities, but people might not be aware that they're happening somewhere, or that, a new cafe has started. So it is really important to get the message out. So how do you think the symbol can support that? Or do you see this as a support for your work as well?
Yeah, certainly would see it as support. And in terms of even that word, inclusive community, is really, for me is very strong, because ultimately we all want to live in a society and a community that is inclusive. So in terms of that business engagement, and engaging through the clubs and the societies, it is about, and our workplaces, we all have families that, we're all, so in terms of that certainly will be an additional tool in supporting that awareness and increasing that awareness.
Yeah, that sounds fantastic. Thank you so much. And I just want to briefly come back to Kathleen, just maybe to give you the last word, Kathleen. If you'd like to encourage people to get involved, what would you like to say to them?
Well, first of all, that knock on the door was from somebody that I haven't seen in 3 years, and he wants to know what the hell I'm doing with a poster on a bus stop. So he's sitting inside. So if ever an image would come up, that like making such a difference, that's the fourth person now that has actually made contact with me since that symbol came out. Now that speaks for itself. The other question was, how do we plan on getting it out? Or, sorry, can you ask me the
Yeah,
second?
and also how can you encourage, like what would you say to encourage people to get involved? Because I know you speak to all of your businesses out there as well. And is there one thing that you can say to them?
Yes, I do. I think, first of all, in particular, the likes of places like hairdressers, beauty salons, newsagent, they're the ones that I have conquered at this moment, and they're absolutely so respectful of what I'm saying for a start. One particular shop in Boots, I was having a very confused day. Now, they clearly knew about the symbol, and about IDWG, and they said to me, I said, "Were you having a problem?" Because I actually was giving them my phone to take the money out of my, which I thought was my purse, and they said, "No, you're okay. Do you have a little problem?" And I said, "Yes." And they took the purse out and took what I wanted and put the change and the receipt into my bag and handed it back. Yeah. And to me, that was a plus, because if we were able to go out and put symbols on every door, we'd make a difference, but we'd make a bigger difference if we got small groups together, like the newsagent, the beauty salon, the hairdressers, which for me are all 3 places in one place.
Yeah.
And that alone, like, they're not just talking about a symbol, we're talking about why we have a symbol.
Yeah, absolutely, Kathleen. And I think that's really, really powerful to also stop on that and to really do encourage all of our national partners who are out there to embrace the symbol. I think we've really heard how important it is, and also for our community champions as well. And I can just say a massive thank you to everybody who has been so active out there and really have been embracing it, and also to all the members of the Irish Dementia Working Group and the Dementia Carers Campaigns Network who've really been supporting our campaign throughout. So thank you very much to everybody, and we're really happy if you want to be in touch and send us an email. We're at understandtogether@hse.ie. Thank you.